lot of times people come in with chest pain or potential cardiac symptoms that it's really impossible to know without appropriate investigation. So what I'll end up doing with these people in a lot of cases is picking up the phone and calling to the clinic next door, who are an excellent group of cardiologists in a diagnostic center.
It's great to have cardiologists nearby that can assess the patient, organize whatever testing is appropriate. I can get people seen in a timely fashion and in a, get a global outlook on what the patient's problems are.
So if there wasn't a clinic like that, I would have to send these people to a cardiologist somewhere. Who knows where that office would be. I would either set up the test myself, in which case they would be booked for a period of time down the road, whether that be 4 days, 5 days, a week, 2 weeks, depending on the clinic that we're sending them to. And then once I get the results back from that, I would then make a proper referral to a cardiologist, or I would send them to the cardiologist outside somewhere. The time frame would be probably 1 to 2 weeks in most cases. And then they would see them and make a decision as to what's necessary.
My concern, if they can't get testing on a urgent basis, is that they may end up going through the cracks, being missed, or having an event happen to them, either a stroke or a heart attack in the interim when we aren't able to get the test.
This is the 21st century. We're in a world-class medical facilities and world-class healthcare. And if we have specialists who have expertise and know best what tests there are to be ordered for these people, available and ready to do it, I think that it is not a fair thing for the patients to have to be delayed.
Patients will die as a result of not getting the most timely access to a cardiologist. I think it's going to be a real catastrophe if this is allowed to occur, that cardiologists will not be able to do self-testing or self-referral and do the right tests for patients.
The system as it is right now allows us the opportunity to make diagnosis in a pretty expeditious fashion. And so somebody who's having pain or somebody's having a situation in any specialty that we're just not sure about but could be something very serious, we're now able to make those diagnoses pretty quickly and act on it. If we had to go back to a system where this doesn't work out, I think what would happen is you'd go back to the days when people would die waiting for tests, waiting for referrals.
Well, my fear is that this is just the beginning of the interference by government into trying to determine what seems to be adequate care for patients in Ontario. I think this should be something that's discussed with the parties that are involved, including patients and doctors and government, and not being just one-sided. I think it has to be a discussion of what's going to be best for the citizens of Ontario.
The ability to have people looked after for whatever problem they have by specialists in that area in an expeditious fashion and able to be dealt with that day, the next day, and dealt with appropriately really is a very big benefit to the population of this country, and making sure that untoward outcomes don't happen to people.